back. The Houston heat becomes even more uncomfortable when you have to hide unsightly veins and ulcers. Our next guest spent years suffering and wasn't able to discover the underlying problem until he went to Hamilton Vein Center. Here to explain, please welcome back Dr. A.J. Valenson, along with his patient, Bobby Philipp, and Bobby's wife, Sharon. Good morning.
Good morning.
All right, so many times you see their story, which we'll talk about in a minute, but of people who come in who have been to so many other doctors and thought it was a dermatology problem as opposed to what's really going on underneath.
Yes, not just dermatology. Sometimes doctors tell patients they're just getting old, they're out of shape, things like
good, right?
this.
You're just getting old. Get out of my office.
Yeah, but it's a very common story where patients for years are looking for help, go to many different doctors and specialists, and just unable to diagnose the disease.
Yeah, and Bobby, you went through that. I mean, you knew something was not right, but weren't quite sure what it was.
That's correct. And I kept having skin ulcers, and they would just get worse every time I'd have a breakout. But the doctor was giving me antibiotics for it, but it never really cured it.
Yeah, and Sharon, that really impacts the quality of life, doesn't it?
Absolutely. Absolutely did.
Yeah. What were some of your other symptoms that you were having?
Well, my legs felt tired all the time, and they would swell. I mean, a leg would get twice as large as it normally would.
Yeah.
You know, it normally would look like it'd be twice as large, and I had a problem with walking.
And we see this. We see people walking around that way, and you think you have no idea what it was. You're told you have the cellulitis. They prescribe topical ointments and even steroids. And at the end of the day, none of that was getting to the root cause, which is oftentimes veins.
That's right, Deborah. Yeah, vein disease is extremely common. Approximately 40% of all people suffer from it, whether they know it or not. And when it gets really advanced, you can get skin changes, ulcers, severe pain, debilitating swelling, things of that nature.
Yeah.
And
that's when it
a
gets
very
severe.
common patient.
Oftentimes, like we see these, like the ulcers, this is the thing that a lot of times dermatology is treating when it's not getting to the root cause. But sometimes it's just the tired leg. Sometimes it's just restless syndrome. Sometimes, you know, it's things that you don't visually see, but when by the time it comes to the surface like this,
right.
It's pretty advanced.
Yeah,
right?
that's very advanced disease, but you could have symptoms even with a disease that's not that advanced when you don't really have any visual appearances. So
right.
Things to keep in mind if you have any swelling or tiredness or just achy, crampy legs after sitting or standing a lot at work. That could be a clue that there's vein disease going on as well.
Okay, what is happening to the veins that is making us have these types of symptoms?
Well, the veins get stretched out over time, and sometimes they just get deformed and they never go back to normal. So you have what are called valves, little flaps in the veins that control blood from running backwards down the leg. And when the veins get stretched out, the blood is going to run backwards with gravity. It's going to usually pull at the feet and ankles, and that's where the changes usually begin.
Yeah. Now, back in the day, they did this thing called vein stripping. Yeah, were you familiar with that?
Yes,
Yeah.
very much so.
And that's one of those things that would make you want to put it off. If you could put a cream on it instead, you would want to do that. But today, we're talking earlier all throughout the show about medical technology and the advancements we've made. It's different.
Yeah, the vein stripping was probably worse than the actual disease itself. Fortunately, now we do the treatments through what's about a 1/4-inch incision. Usually it takes about 15 to 20 minutes a procedure. And it's minimally invasive, minimally painful. So it's come a very long way. There's no reason to wait.
So when you went through this and you finally found the answer, that had to be a weight lifted off of you. But the actual procedure you went through, how did it feel?
It felt fine. In fact, I could have went to sleep while he was doing the work.
Yeah.
Oh, man.
And then you could have gone shopping right after you got done, right?
That's right.
We did.
She said we did.
We really did.
We really did.
We really did.
What change have you seen in your husband since doing this procedure, which just takes a matter of minutes, really?
He, prior to seeing Dr. Valenson, when he walked, he shuffled his feet continually. I mean, and I kept telling him, honey, pick up your feet, you're shuffling. He said, no, I'm not. And I said, honey, you don't realize it, but you really are. And he says, well, okay, I'll try to do something about it. But I noticed he was going downhill as far as energy level, inactivity. He just got to where walking was just a real issue for him. And I said, there's something else going on here. We're missing something. And I said, we need to find out what's causing this problem. Because every time he would get a breakout, it would be worse every time.
Yeah.
When it came to the surface, the ulcers were terrible.
And then today?
Today's wonderful.
You got your Bobby back.
Yes.
And what you're able to do is go in and collapse that vein that's acting up, and then we have plenty more veins to take over, and it just gets rid of that problem. Hamilton Vein Center has multiple locations around Houston, including Clear Lake, where Dr. Valenson sees patients. For more information and to schedule your free consultation, you can call 281-565-0033, 281-565-0033, or log on to hamiltonvein.com, and you can check really easily. It's just a couple of minutes that you can check in a painless way to see if really that is the issue.
A couple of minutes is all it takes.
All right. Thank you very much. And insurance pays for this. This is a medical issue.
Yes, ma'am. This is a medical necessity.
All
Absolutely.
right. Thank you very much. Now you can go shopping. Up next, can't sleep, or worse, are you up all night because your partner's snoring is so loud? There's a solution for that.